Osteoarthritis is a very common problem. Only 10% of the patients need surgical procedure. And we have a great solution for those who need surgery.
But what is it? And why does osteoarthritis happen in the first place? Let's find out.
This is Dr. KJ Reddy, Orthopedic surgeon. Today we are going to talk about osteoarthritis, especially of the knee joint, which is very common. Osteoarthritis is nothing but wear and tear of a joint, and it mainly affects knee joint, hip joint, joints of the arm. Basically what happens is the end of the bone forms the joint. It is covered by the cartilage. The cartilage gets wear and tear and it doesn't get repaired. So the bone under the cartilage gets exposed, which becomes painful. Cartilage is most important part of the joint. It covers end of the bone where it forms joint with the other bone. It is avascular. That means it does not have any blood supply, does not have any nerve supply. So any damage to the cartilage is not repairable. So it's very important to protect the cartilage so that it won't get damaged permanently. Otherwise, it will lead to osteoarthritis. Anybody can be affected by osteoarthritis, but mainly middle-aged and elderly people gets affected by osteoarthritis, especially after the age of 40, 50, because wear and tear. Every person have the ability to repair some level of injury to the cartilage. If this repair is not done or is broken down in osteoarthritis, and that leads to arthritis, which will become painful. The exact cause of osteoarthritis is not known, and most of the time it is wear and tear disease. So the normal mechanism of cartilage repair is lost. It runs in families, and it also affects people who do not have strong muscles, who have sedentary lifestyle, and who joints are affected in the past by injuries which are not treated, or infections, or conditions where, like in uric acid high levels, which will lead to gout, the crystals get deposited in the joint and the cartilage gets damaged, leading to osteoarthritis. Main symptom is pain. Initially, the pain will be in heavy physical activity. Later, it will lead to normal physical activity, and this pain can lead to rest pain and pain disturbing sleep. Most important symptom, pain is associated with swelling, and sometimes if severe, it leads to deformity, difficulty in walking, especially climbing stairs, difficulty on sitting on the floor. The osteoarthritis is treated based on the stage of osteoarthritis. There are 4 stages of osteoarthritis. Stage 1 is mild, stage 2 is mild to moderate, stage 3 is moderate to severe, stage 4 is severe osteoarthritis. Stage 1 and 2, 90% of them treated non-operatively with a simple modification of their activities, physiotherapy and simple painkillers like paracetamol. In stage 2 and 3, sometimes we inject fluid, that means joint fluid into the joint, which is low or not healthy in the knee joints. It helps. Also, we treat with the PRP, that's a stem cells or platelet-rich plasma injection into the knee joint, which might improve the quality of the cartilage, also might help to improve the repair of the cartilage. In stage 3, where there is swelling of the joint, there is fluid in the joint, there may be loose bodies. This condition can be treated with arthroscopic surgery. That's a keyhole surgery where we put endoscope or arthroscope into the knee joint and use laser equipment to remove the loose bodies or remove the debris in the joint and remove the fluid, which will relieve symptoms. Nowadays, there is a remedy. In the past, maybe 30-40 years ago, these people used to suffer and used to die with severe osteoarthritis. Now, as most of you know, knee replacement is the solution. And the total knee replacement has changed the way we look at this condition in modern orthopedics. It has revolutionized the treatment. If it is done in the right patient, it's very successful. So now we discussed about osteoarthritis, which is a very common problem. As you realized, osteoarthritis is treated non-operatively in 90% of the patients. Only 10% of the patients need surgical procedure. And we have a great solution for those who need surgery, especially knee replacement. As I said, those who have severe symptoms affecting their quality of life should see their doctor and probably take treatment if it requires knee replacement. Nowadays, we do fast-track knee replacement, which is less painful, fast recovery. We send you home on the same day or following day.
MTC is with you every step of the way. For your medical or dental trip, contact MTC today.